In the area of social inclusion, where we've come in research is really distinguishing between physical inclusion and social inclusion. So a lot of the previous research had been about sheer numbers, like what kind of places people were living in. Were they living in institutions versus community homes? But what kind of community activities did they have? Did they go shopping, into restaurants? Were they physically participating in the community? Were they physically present in places like churches, other kinds of congregations? But more recently, there's been much more research about social inclusion, which is people's relationships with community members, people's relationships and belonging in community groups and organizations. How can we intervene in that? How can we support more of that happening? And what a lot of the research shows is that most of people's social networks is still mainly consists of family members and other people with disabilities and staff. That's the vast majority of people's social networks, and people have very little interactions and relationships, meaningful relationships with ordinary community members, although that is definitely starting to increase in very specific projects. I'm going to review those 4 questions. I'm going to give you a brief summary about those 4 questions in terms of community participation and social inclusion. So the first question was, what are the established research findings in this area of social inclusion? What is it that we know? So one way that we kind of look at that or track that people have is just sheer counting. Just sheer counting in terms of institutional environments versus community environments. This is one of the things we track at the research and training centers, how many people are in institutions, and you can see that number decreasing. This is, of course, in the US, but that's tracked in many different places. We track how many people are in integrated employment versus the total number of people who are in any kind of day program. That's like one way people look at inclusion, but research has evolved. We really have distinguish the differences between physical integration and social inclusion. So what are the current research findings? What do we know about community participation and social inclusion? I'm going to summarize 3 main areas that people have studied. The first one is in terms of measuring. So just measuring, counting the degree of integration or inclusion. There's different things that people have counted. The number of people who are in integrated settings, like the examples I gave you. People count the number of community activities people do. How much do they go to restaurants or shopping or churches? What's the size of their social network? It's another thing people have counted or measured. There's some overall results, there's kind of summary results that we see are trends, is that the social networks of people with IDD are primarily paid staff, families, and peers with disabilities. That's the big majority of their social networks. For people who live with their families, most relationships are mediated through the family. And that people may be physically included, but there's big gaps in social inclusion. So those are some of the trends. And Mary McCarron's going to give in her presentation about a big study they did in Ireland that looked at some of those trends, for example. So a second big arena of research is what are the different factors that affect the degree of social inclusion. So, and people have found different things, that there are some individual factors, for example, the degree of disability. If you're less mildly disabled, you tend to be more included than if you have a more severe, profound degree of disability. And people have studied environmental factors, such as residence size. You're in a larger facility, you're less likely to be included. And there's other individual and environmental factors that people have studied and found. And then the third big arena of research is just interventions. Are there things that we can do to increase social inclusion? So when people were first coming out of institutions, it was a matter of, oh, people are in the community but not of the community, right? But what can we do to really impact that? And there are strategies and methods that work. When Roger Stancliffe presents in this session, it's an example of a program in Australia to really increased social inclusion. So those are kind of three big arenas. People have studied inclusion over many different environments. So schools have been very intensely studied, and everything from preschool up all the way up to college programs. And then in employment, people look at the people's relationships, workers' relationships with their non-disabled coworkers, what kind of a social inclusion is there. In community living, primarily with adults. And then there are some studies about specialized environments, for example, faith communities or community groups. So this is just a construct about how can we look at the depth of relationship or the intimacy of relationship. The outermost circle is the biggest, the purple circle, starting at the bottom in terms of the wordings about we can look at physical presence, people simply being physically present, and then coming in to more depth of relationship or inclusion. The blue circle is shared activities in that community setting. Are they in a place where they are sharing activities? But then in the next circle, the yellow circle, does that extend outside of that setting to other social activities? For example, in employment, people may be in a competitive employment and work alongside non-disabled people, but are they socializing with people outside of that work environment? And you can look at that in many different, across the different environments, we can look at that. And then does it move to a deeper, more meaningful relationships? And in the innermost circle, shared lives. So, Luana Meyer summarized the factors affecting greater social inclusion in schools, and she used a model of that. It's a table with 4 legs, and if that one of the legs is off, there's something missing. If you've got all 4 legs working, you've got more inclusion. So she found these were the 4 legs: the child's repertoire, not necessarily their level of disability, but their repertoire in terms of being social. What were the non-disabled peers' skills, supports, and expectations? The social ecology of the school. Was it a cooperative learning environment in the school? Is there a non-specialized curriculum that promotes belonging and respect for diverse learning styles? And then how much adult mediation is there? For example, is there peer planning like circles of friends or MAPS programs? And she used the term the Goldilocks model, right? Not too much, not too little, just the right amount of intervention and support. And it'd be interesting to look at these 4 elements across all the different environments. For example, across community groups, across work environments. How do these 4 things work in terms of, for example, the mentors in a supported employment or competitive employment? How's that mediation working, or what's the social ecology of a community group? So we can look at these things across the different environments, not just in schools. So we can look in work environments, what people have found in terms of strategies and methods that work, the factors that affect greater success, and to what degree are relationships with non-disabled coworkers supported. If they see themselves more as a mentor, that increases the social inclusion. And a big factor is how is the role of the job coach framed? So, is the job coach an interference to relationship to other people in the workplace, or do they really see their role as one of facilitating relationships? In community living, people have looked at individual friendships, so one-on-one friendships with people, as well as group membership and being part of a community group. Here's some different strategies that people have found have worked: is person-centered planning circles, social inclusion facilitators, and community mapping was a intervention in Seattle where people mapped the places of belonging in the community. This was a 5-year study we had done at the University of Minnesota, and we looked at 3 outcomes. What were the gains in individual community friendship? Went from 16% to 78%. What was the membership in community groups? Went from 2% to 42%. And what was the increase in community social roles, like being a church greeter? Went from 3% to 36%. So there are definitely strategies and methods that work to increase social inclusion. Here's one of the key factors that affects the success in that is regular, ongoing social contact with meaningful interaction. So not just the same waitress in the restaurant, but what kind of meaningful interaction is there with community members, like in community associations and groups, in faith communities. When I do a lot of training in our intervention studies, it's really working with staff and agencies and systems to shift our thinking from activities, like community participation, to people, and ask the question, but who are they going to get to know there? And then, as I said, people had also studied specialized environments like faith communities, again, looking at both individual relationships, how can faith communities support one-on-one relationships or support more group membership. And then the largest kind of context or studies or interventions I want to talk about is ones that really look at the whole community. So in this diagram, the lower right represents the services system, the upper left represents the community, and we know there are these boundaries dividing those two worlds, those two parallel universes. There's boundaries dividing them. How can we bring people together across those boundaries? Many of the approaches, I'm going to move to, many of those approaches are from the people with disabilities or the agencies up to community. Many of the projects or interventions are about how can we go this way. But there are some projects and interventions about how can we get the community to come this way? How can we get the whole community to come this way? So that's another kind of perspective or framework. And so there are some projects about that, some really based in asset-based community development, if you know the work of John McKnight, building social capital. We've had community member forums to really bring people together, community members together. There's some other projects too. So that's in terms of what it is that works, what it is that we know. And the second point was, what are the big debates and points of contention about social inclusion and community participation? So I think the first one is really how and what do we measure? People measure different things across different studies. And what's the difference between social integration, inclusion, participation, and belonging? It means different things in different studies. It means different things to different people. So the second thing is, how do we account for an individual's preferences? If some of you I know are much more loners than other people, and you like it that way, you don't want a lot of friends or community participation, how do we account for a person's preferences? But also, how do we account for their lack of experiences? If someone's in the sheltered workshop and says, I don't want I'm comfortable here with my other friends with disabilities, I don't want more community friends. What about their lack of experiences in that whole phenomenon of what it is they express as their preferences? Is more social inclusion better for everyone? We look at, a lot of the studies are looking at more, measuring more, but really is that better for everyone? How do we account for individual preferences? And then the third debate is about what's really the role of staff? Are staff really friends? Do staff provide people a sense of belonging and acceptance? Or are they not? Are they not? The third area that we're looking at is what are the emerging and unanswered questions? So really this complex interaction about the person, their environment, social and cultural factors. There isn't any agreed upon kind of theoretical framework in this. What is a theoretical framework that we can really look at? A sense of belonging is subjective. Whether people belong or not is subjective. For example, there might be someone who has a lot of community friends, but they may be lonely. They may report loneliness because they don't have a girlfriend or a boyfriend. You know the degree to which people complain about that or want that, right? A girlfriend, and so they report being lonely even though they're very included in the community. How do we account for that? Or they may have many close relationships and friends with peers who have disabilities. So how do we account for that in the theoretical framework about what's really desirable for each person? The second thing is, how do we move from community activities to a sense of belonging? What's really successful in promoting that? As more students graduate from inclusive school settings, what happens And how do we support relationships after graduation? There's not a lot about what that transition is and continuing that. And most of the studies have been done in places who are living out of their home, right? Studies have been done in residential settings, but we know the vast majority of people with disabilities live with their families, or they live on their own. So how do we support social inclusion for people who are living with their families or on their own? This is an emerging question. How do we account for interaction through social media? If you have 1,000 Facebook friends, does that mean you're more socially included? Even if you don't see a community member face to face? So this is an emerging question, accounting for that. As environments are more integrated and individualized, there is much more emerging about people not being safe, people being taken advantage of, people being abused in schools, a lot more increasing about bullying, for example. So what do we do about that? And then what are the implications for what we've learned for developing countries? I presented a couple of weeks ago at the National AAIDD conference and about our projects in Minnesota about increasing social inclusion with community members, and somebody from Ghana and somebody from Haiti both came up and asked me, well, what does this mean for our country where people are so devalued, have no community social roles? What kind of progress can we recommend? What kind of recommendations can we make about development? Because most of the studies about social inclusion are in the more what we would call westernized or developed countries, right? So what are the implications for that? And then lastly, it's really what are community members' attitudes toward inclusion? I don't think we've studied community members enough. Relationships are two ways. We look at individuals with disabilities. We haven't looked at community members enough. What do they think works? And then the last section is what are the next research questions that need to be answered? So what is a conceptual framework for understanding and measuring the many different aspects of social inclusion? How do we bring what works up to scale? So we know that there's things that work. How can we have that be the norm rather than the exception? Or if you were in the presentation on Tuesday from Australia about the Wednesday about the retirement program, somebody there said, we should be doing this for everyone, right? This should be the norm for everyone about people being in community groups. So how can we have that happen? And how can participation in current environments be expanded to deeper relationships? People are in places now, but how can we expand the depth of relationship? How do we address social inclusion for people living with their families and on their own? As more people receive individualized support, how can they be supported to increase community belonging and yet not be victimized? How can we more effectively support intimate relationships for those who want them? Again, what are the lessons for developing countries? And how can we support greater involvement on the part of community members? What are effective approaches or models in the eyes of community members? Thank you.